Infertility affects millions of people across the globe with impacts on families and society. Estimates by the World Health Organization suggest that approximately 1 in every 6 people of reproductive age worldwide experience infertility in their lifetime. How do we advance ethical practices in third-party assisted reproductive technology to rid challenges associated with reproduction and fertility to promote family health? My guest, Dr. Sunday Ono, obstetrician, gynecologist, Deda Hospital, will speak to us. Dr. Ono, nice to have you join us on Insights.
Thank you very much. It's a pleasure to have me here this morning.
Thank you so much. You know, our infertility is a cause of concern in the field of medicine and, of course, in society and families. Educators, in both men and women, what factors contribute to infertility?
Yes, infertility has been described, defined as inability of a couple to function after 1 year of regular and unprotected sexual intercourse. So, definition is not just arbitrary. Based on the fact that when people get together, it takes a process, to finally achieve a conception. But if that timeline is exceeded, in most cases, and sometimes depending on the age of the woman too, we can actually modify the timeline to bring it lower. There are factors that are responsible for infertility in men and in women. And before now, it's only the female folk that have been, particularly in our part of the world. However, it's becoming very obvious that both male and female are equally affected. Factors that affect women can be divided, those that can affect from the level of the ovary and those that are affecting from the level of the cervix and environmental factors, as it were. So if we take them in a brief, inability to ovulate, we call them anovulatory factor. Those are the ones coming from the brain to the ovarian level. Then there are factors that affect the structural anatomy, that is tubal factor. The tubal blockage is one of the major factors that causes infertility in our own environment. And this because of high incidence of infection, and pelvic surgeries and some other factors like endometriosis and co. Now we have other factors like uterine fibroid. These are growth within the womb that can affect the reproductive function of a woman. We have factors that also at the cervical level. Some people have very tight cervix or something trying to block the cervix, as it were. Then some women have some factors within the cervix that are hostile, irrespective of how good the sperm is or how well the woman is ovulating. Whenever the sperm comes in, it's destroyed. So fertility don't get to happen. Sometimes it's just because of, knowing the appropriate timing of ovulation. Simple knowing the appropriate timing of ovulation can cause a delay. You can see that there are a host of factors there. And we'll look at the male side. Most of the things that happen on the male side are targeted towards reducing or eliminating the sperm count, as it were. Over the years, the sperm count and quality have been declining. One, due to environmental factors, whatever we're eating, and sometimes genetics. It is really diagnose a male factor infertility when we do sperm count, and we'll now see that, sperm is low. But now, getting to the root cause of this thing sometimes can be difficult. Then we have issues that can deal with, that are related to the brain level, and issues that are related to the testes, issues that are related to hormones that feed the testes. So at the male level, we have different things that can happen that can cause infertility. Infection is one of them. Even trauma in terms of injury to the testes. Some people in childhood, most often in childhood, and this can also occur in adults, when the testis is twisted, and that can bring about a decay or lack of blood supply to the testes. That reduces the blood flow and eventually some of the cells that are active within the testicular tissue.
You've talked about the clinical aspect and the anatomy of a woman and a man, but really, what has lifestyle got to do with this?
Yeah, okay, yeah, I'm coming to that. Lifestyle has a very, very major role to play in
Okay.
infertility, as it were, because when we talk about lifestyle, whatever we take in, that can affect us. The use of illicit, use of drugs, hard drugs, the likes of marijuana, cocaine, and the rest, affect reproductive function. They affect the sperm function, particularly in males. Then excessive use of alcohol also have effect on male reproductive system. In women, we have what we call the polycystic ovarian syndrome, which is a syndrome that affects women that could also lead to excessive weight gain. And when there's so much of weight gain, the fat in the woman can be broken down and converted into male hormone, which we call the androgen. And this can, affect the effective functioning of the female reproductive system. So lifestyle really have a lot to play now in a reproductive function, both in male and in female.
And in female. Okay, you are a member of the Association of Fertility and Reproductive Health. What steps are taken to advance technology, assisted technology, to address issues of infertility? Because it's a global thing affecting millions of people.
We are taking both steps in order to bring advancement into fertility treatment, particularly the area of in vitro fertilization and embryo transfer. I will tell you that, not long before we started in vitro fertilization, we moved on to the advancement called the intracytoplasmic sperm injection, which came to take care of the male factor infertility. There are some men that the sperm is really very, very low, that ordinarily the conventional IVF will not be able to solve that problem. So intracytoplasmic sperm injection, which is picking a single sperm for an egg, came on board. And I will tell you that virtually all the standard clinics within the country have that technology in place. IVF practice and treatment is a continuum, is a continuous change and improvement and innovation. We're trying to collaborate with our counterparts in the developed world, to make sure that we're not lagging behind in any advancement that has come in. I will tell you now that the advancement in area of pre-implantation genetic diagnosis, this one is trying to test the embryo to make sure that it is genetically, chromosomally normal. Or in other area, there are some people who are AS, and one couple that want to marry and have children that are not SS. We also provide these services through pre-implantation genetic diagnosis to make sure that every embryo that is coming out is screened, and it's only the one that is free of the genetic element that is transferred. So, and I'll tell you that a lot of centers have been developed within the country, within our association membership, to make sure that this is done from A to Z within the country. And
okay,
not
Dr.
sending
Anu,
samples.
I'm sorry I have to come in there.
Yeah.
For those willing to take advantage of the technology available, for instance, you mentioned IVF, what are the chances? And I need you to clear the air on the issue of having IVF and having twins. What are the chances?
Oh, wonderful. The issue of having IVF and having twins has been a big issue because I've been confronted severally. People will just come, even when they do not have a fertility challenge. They say, "Doctor, I've come, I want to do IVF because I want to have twins." And the truth, the fact of the matter is IVF does not guarantee twinning. And one, as an obstetrician, you know, we do not encourage multiple gestation. That's twinning. In the developed world, it's a crime, you know, for you to treat a woman and the woman will have twins in the course of doing IVF, unless it is one embryo you transfer and the thing is split into two, because they are trying to reduce twinning rate. The reason is there's so much complication that could arise from multiple pregnancy, you know, and that has a lot of burden on the patient, a lot of burden on the health system, a lot of burden on the babies that are also born from from twinning and triplet, because they most often will come preterm with a lot of complications. Be that as it may, here people want to celebrate twins and the rest of them. So we try to educate them that if you come in because you want twins, we discourage you professionally. If we transfer embryos, it does not mean that when pregnancy occurs that the two will implant. It could be one or the two of them, or sometimes none will implant. So it's not like a see that when you come to IVF, you're going to have twins. And one thing that is making people say, let me do IVF because I want twins, is because when they see people with twins outside, that they ask them, is IVF they did? So it's now being believed that, oh, everybody with twins must have done IVF. No. Those that did IVF and have one, nobody asked them whether they did IVF or not. So it's only those that are having twins that they are asking and now believing that, oh, once you see twins, it's IVF. Thank you.
So IVF does not guarantee having twins. Okay, now, as a medical expert, would you say infertility should be regarded or treated as a disease?
You know, wellness have to do with mental health, financial health, everything. So infertility is actually a disease that to be treated like any other disease, so that emphasis can be given to people who have infertility. You know, people with malaria, people with typhoid, people with, let me say, hypertension, people with this are being treated very well under the insurance scheme. But when you talk infertility, every insurance will just shy away. No, we can't cover this. No, we can't cover this. It's only few insurance I've seen in this country, and those are international insurance that have really, covered treatment like IVF. You know, so the insurance within the nation, including NHIS, tend to shy away from treating infertility as, to the core. When it gets to talk IVF or treatment, you know, they shy away from it. So, yeah, and it's a burden. It's a burden. So we should not leave these people alone. We should make them enjoy others can enjoy. And the whole nation will be better for it.
Dr. Sunday Ono, I want to thank you so much for joining us on Insight today. Thank you for educating us. Thank you so much.
Thank you. It's a pleasure now and always.
Thank you very much.
And that's it on this episode of the program. Do join us same time next week for more on Insight. My name is Nnamdi Odipo.
And I'm Elizabeth Omori. We'll see you next week. Bye for now.